Quest began on October 20th, 2014 in response to the CMS and Joint Commission surveys around that time. The Quest nurses are in a key role to demonstrate patient care excellence. Our current role includes ongoing surveillance and auditing of department-level compliance with regulatory standards, education of frontline nurses and physicians, just-in-time, one-on-one, or in a group setting, identification of patient safety risk along with gaps in our current systems and processes, as well as application of our clinical expertise to actually help to redesign the systems and processes to support the delivery of high-quality patient care.
So they pulled one nurse from each floor to create a group so that we could actively participate like hospital-wide and create change from a unit perspective. Well, we work with a lot of different departments. Quest stands for Quality Education Patient Safety Team, and so we work with the quality department to make sure that the audits and the documentation is correct, and we work with infection prevention to help decrease the risk of infections while you're in the hospital. So we do our best to remove central lines and Foley catheters as quick as possible.
Every day varies as far as the priorities, but there's a consistent theme of making sure that we're providing good care, that we're looking at our environment and ensuring that it's safe for not only the staff but for the patients, trying to better the processes clinically for the nursing staff. It's kind of difficult to say what you do every day. Today has involved auditing an infectious disease process that we've just implemented here, including the Kuros caps, assisting nurses at bedside with a task or clinical skill that they need, as well as chart auditing to ensure that we're meeting the requirements that we need to.
Now what my day looks like typically, we've been at it for about 8 months now. We usually meet every single morning, Monday through Thursday, in the old ICU room, and we work with all the other departments to collaborate, work on safety initiatives, bring our concerns from the staff, and then also from all the other departments, their concerns, we bring that back to our department to kind of work together as a team to improve safety in our department.
And we also focus on the risk of developing a blood clot while you're here in the hospital so that those incidences don't occur at Mission. And we also are really concerned about falling while in the hospital because everybody in the hospital is at a higher risk than normal when you're at home for falling because of the medications we give you and the disorientation to the hospital floor.
It's exciting, it's challenging, it's rewarding. It gives me a different way to facilitate change. As a bedside nurse, you're dealing with your patients and their specific needs, or as a relief charge, you're responsible for the whole unit. And in the Quest role, you are looking at the entire scope. It's a broader look at patient safety, the objectives of the hospital, infection prevention, documentation, patient education, more of a broader stroke.
My favorite thing about being a Quest nurse at Mission Hospital is making the staff happy, because now the staff have more of a voice and they know every day they can come to me with their concerns and it'll get addressed the next day. So anything that they find that's a safety issue or something they would like to have that'll make their workflow better, I can bring that up the next day, and I have contact with those key players to get what they need and get things done. So staff feel empowered, and I can kind of assist with that.
The best thing about being a Quest nurse at Mission Hospital is being able to affect change not only at the bedside level, but through nursing practice as well. And we've been able to make drastic changes in a very short period of time, which may not have been able to be done by a group of individuals within the hospital that weren't necessarily nursing-based bedside practicing nurses.
I love the Mission Hospital family. I love when I walk down the hallway or in the cafeteria and I see friendly faces and smiles all around me, and I know that we're in this together. We're a team, we're a family.
We love Mission!